Well, my friends, this is a case of a village gentleman, age about 58 years only. He has developed the disease known as multiple myeloma, which produce a group of symptoms or syndrome, and for which he had already treated from the Apr-1 hospitals of Chennai, and they have already treated and diagnosed the case as multiple myeloma. Multiple myeloma. The treatment of the Apr-1 hospital is very costly. This is a village poor person. So the patient is brought to me. So the patient has to brought to me a social worker, a teacher, number one. Paritosh Manna, a school teacher, a lover of homeopathy. He has brought the patient for consultation in homeopathy. Now, for multiple myeloma, he visited the Apr-1 hospital. Now, the present symptomatology, ascites developed, cough aggravates at night, anorexia. There is total loss of appetite. খিদে একদম নেই, খেতে চাইছে না, খিদে পায় না, তোমার খিদে পাচ্ছে না। খাই দই দিয়ে আর কি অসুবিধা হচ্ছে? কষ্ট বলতে এবার হাঁটতে গেলে কষ্ট হয়। হাঁটতে গেলে কষ্ট হচ্ছে। So difficulty in exertion, exertional dyspnea, cough, ascites, swelling of the abdomen, ascites developed, many complications develop. Now, what is multiple myeloma? Multiple myeloma is a malignant disease. It is a type of CA that forms in the form of loss of the strong WBC cells. The white blood cells are converted to plasma cells. Neutrophil, lymphocyte যেসব যুদ্ধ করে, শত্রুদের বিনাশ করে, সৈনিকের কাজ করে, তারা কমে যায়। The white blood cells is converted to another kind of cell which is known as plasma cells. So healthy some plasma cells helps to fight infections by making proteins which are called antibodies. Antibodies attack the germs. Now normally the WBC is destroyed and converted the plasma cells. So the disorder caused by malignant proliferation of special cells formed in the bone marrow, which is called the plasma cells. And the plasma cells normally produce protein antibodies, but in this case, in multiple myeloma, a large quantities of abnormal plasma cells are formed. They can be detected in the blood routine examination and also by urine culture. The cells invade the bones themselves, leading to erosion and spontaneous fracture. So weakness of the bones is the important symptom. হাঁটতে গেলে অনেকে পড়ে যায়, হাড় ভেঙে যায়, হাড় ক্ষয় হয়ে যায়। In addition to this, there is marked bone pains and other systemic or constitutional disturbances like malaise, anemia, pyrexia, etc. There is no curative treatment. There is no curative treatment. In modern medicine, allopathy, melphalan, a kind of some drugs, special drugs, improves, helps to suppress the plasma cell activity, and which is followed by them the radiotherapy treatment for relieve the pain of the local bone involvement. So it is nothing but a type of CA of the plasma cells, CA of the blood. So blood CA. So multiple myeloma is not a good disease. It is a very bad type and the prognosis is always bad. So there may be various symptoms, bone pain, especially the spine, পিঠের দিকে ব্যথা হচ্ছে. So pain also to the spine side with nausea, loss of appetite, constipation, খিদে হয় না, টায়ার্ডনেস, ইনফেকশন, হাঁটতে গেলে প্রবলেম হয়ে যায়, এই সমস্ত সিমটম ডেভেলপ করে. So the main cause of these multiple myeloma is genetic mutations, and these mutations are different or differs from person to person. The exact cause of multiple myeloma is unknown. So the exact cause of multiple myeloma is unknown, but the physicians already discovered, identified, or thought that changes in their DNA can make plasma cells into the cancerous. So, multiple myeloma, a very dangerous disease. It usually cannot be cured. So, a type of blood CA. Now in homeopathy, we can improve the life, we can modify the life, because homeopathic treatment improves the immunity of the body, the susceptibility of the body, by our integrated approach of treatment, by our constitutional treatment, by our holistic treatment, that means treat the patient as a whole, considering that the disease is not a part of the man, considering that the disease is not a particular organ related, it is the whole system related, it is the whole man related. So man as a whole to be treated. And this patient represents profuse salivation, mouth odor offensive, complaint aggravates at night, cough aggravates at night, and the tongue is a typical picture of mercurius. Jib dakhan, see tongue is salivated and large indented, ulcerative, salivated, indented. মুখ দিয়ে ঘুমালে লালা পড়ে, ব্যথা বেদনা কষ্টগুলো দিনে বেশি হয় কি রাত্রে বেশি হয়? রাত্রে বেশি হয়. So complaints aggravates at night. ঘুমালে মুখ দিয়ে লালা পড়ে, salivation, tongue is. So the disease itself is syphilitic. The disease itself is syphilitic because destructions of the normal cells into the plasma cells, অ্যান্টিবডি ফর্মেশন হচ্ছে না, রোগ শক্তির সাথে লড়াই করার সৈনিক থাকছে না. Normal cells are converted into plasma cells, a large number of plasma cells and neutrophils. The soldiers becomes lacking. So originally, according to a miasmatic theory of Hahnemann, this is syphilitic and anti-syphilitic. Among the anti-syphilitic medicines, mercurius is one of the strongest anti-syphilitic medicine, and the patient represents all the symptoms of mercurius. So we do like to prescribe mercurial in 50 millimole scale of potential. Oh, Shabash! This amateur homeopath already prescribed mercurial. Thank you very much. But you didn't continue. So let's continue the mercurial from very beginning 1, 2, 3, 4, 5, 6 with that direction thrice in a day, morning, noon and evening. Let's see the result. I shall share you, my friends. ওজনটা রাখো, মেশিন আনো। ওইদিকে একটু অন্ধের হস্তি দর্শন হচ্ছে। দাঁড়ান, টেবিল হাত না, এমনি দাঁড়ান। It is about 62 kilogram. 62 কেজি ওজন আমরা দেখে রাখলাম। So let's see the result. The weight is 62 kilogram. কতটা কি ইমপ্রুভ হতে পারে? Hahnemann's potentized mercury. Once again, we will see the efficacious result of dynamic mercury.